Next, I will be doing the measuring the radial pulse scale. Now in healthcare, we use the radial pulse most of the time. The radial is taken on the inner aspect of the resident's wrist, right here. The radial pulse is taken on the inner aspect of the resident's wrist. The thumb side of the wrist. The thumb side of the wrist. That's where the radial pulse is, okay? And that's very important. Now also, it's important to know that you do not take the resident's pulse using your thumb. So I always tell my students, don't even touch the resident's arm with their thumb. Because if you take a pulse with your thumb, then you'll be taking your own pulse. So make sure you use your fingers to take the resident's pulse. Okay, now make sure you have a watch with a second hand. A watch with a second hand should be a part of your nursing tools. Okay? So invest in a watch with a second hand. It doesn't need to be an expensive watch, but it needs to have a second hand because measurements, pulse, and respirations are done in seconds. Okay, so we're going to count for 60 seconds. When you get ready to count, you need to say start because the tester needs to count with you. Okay, so here we go. Start. Okay, 60 seconds are up, Miss Lisa. You have a good pulse, nice strong pulse. So after you get your pulse reading, after you get your pulse, the tester will give you a recording sheet. And this is where she will show you where to record the reading. Now keep in mind, your reading needs to be within 4 beats of what the tester is getting. Okay? This concludes the pulse measurement.
Okay.
Okay, next, respiration.
Okay. Talking to you.
Oh, right here.
Okay.
What you gotta get?
All right.
You got my phone.
What is that? She said, you got a
I just
thumb.
saw my phone in there.
You gonna look at that and say,
Okay.
Wendy's thumb.
All right.
Okay.
I should have it for me.
Okay. Next, I will be
Oh,
counting.
hold on. Start.
Okay.
You got to move over a little bit because that light.
Right
the
here?
Other way,
Oh,
that light is my enemy.
You can turn it off, Rupert.
Well, it's illuminating, so we need the light.
Okay.
We just don't need you in front of the light.
Okay.
Move over just a little bit.
How about this?
Okay, that'll work.
Okay, next, I will count Miss Lisa's respirations. Now, in real life, when you're counting respirations on residents, if you tell them that you're going to be counting the respirations, automatically their breathing starts to be irregular. The respirations change. So what you need to do is act like you're counting the pulse. After you finish counting the pulse, you keep your finger on the radial pulse and do not let the resident know you're counting the respirations. That's the best approach because try it. If you tell the resident you're counting the respirations, automatically their respirations will change. So, we're going to count again for 60 seconds. Here we go. And always say start when you're ready. Second hand. Start. And you're going to observe the resident's chest rise and fall. Okay, I have my reading. After you have your reading again, the tester will give you a recorded sheet and show you where to record your reading. Your reading needs to be within how many beats for respirations? No, that was for pulse. Rupa said 4. Might be 4, Rupa. I think it's 2 though. 2. Okay. Your reading needs to be
Wait, okay, now, I
You
got
say
to
it
put
again?
the page. Now say it.
Okay. Now remember that your reading needs to be within 2 points of the tester's reading. So what am I talking about? Well, if the tester gets 16 as a respiration, and you get 12, you're going to fail. If the tester gets 16 and you get 14, if 14 is your reading, then you're pass. Or if the tester gets 16 and you get 18, you're pass. Okay. Plus or minus 2 points within the evaluator's or tester's reading. This concludes the restoration